Alcohol is one of the most controversial drinks. Some people say that a glass of red wine a day is good for your heart, while others argue that even a drop of alcohol is toxic for our body. In this discussion, we will explore what alcohol truly is, how it affects our body, and examine some common myths and realities about alcohol consumption. We'll delve into why alcohol causes euphoria and happiness in some people, while in others it leads to sedation and lethargy. Additionally, we'll discuss the impact of regular alcohol intake. And we will cover how to stop drinking. When we refer to alcohol, we mean ethanol type of alcohol which is safer for humans. Ethanol is unique because it is both water and fat-soluble. This small molecule can easily reach the brain by crossing the blood-brain barrier and affects our mood. Because of its fat solubility, ethanol can penetrate any organ and cell in the body and damage them, especially brain and liver. When a person consumes alcohol, a very small amount is absorbed in the mouth, a small amount is absorbed in the stomach, but the majority of alcohol is absorbed in the small intestine. Since alcohol is a toxin, the body works to neutralize it by converting it into acetaldehyde, which is still toxic. Acetaldehyde is then converted into acetate, a less toxic substance, which is eventually converted into carbon dioxide and water and excreted through lungs and kidneys. This entire process is called alcohol metabolism, which primarily occurs in the liver. Consequently, the higher the dosage of alcohol consumed, the greater the toxic effect on the liver. After consuming alcohol, it rapidly affects the brain, leading to feelings of euphoria due to the release of dopamine. This increase in dopamine creates feelings of pleasure, euphoria, and a sense of well-being, often making people feel more sociable and less inhibited. Initially, alcohol acts as a stimulant. However, it is still considered a sedative. Why? Because alcohol's affects not only dopamine, alcohol also binds to GABA receptors, which are the primary relaxing and sedating neurotransmitters, preventing neurons from activating and making the person feel sedated and sleepy. This slows down brain activity and decreases actions, focus, and attention. Alcohol also inhibits glutamate receptors, which are the main excitatory neurotransmitters in our brain and are crucial for high cognitive functions like reasoning and decision-making. Therefore, alcohol intake directly decreases our cognitive functions. Younger people tend to metabolize alcohol faster, meaning their sedative phase comes sooner because their livers work more efficiently and lower the alcohol level in the blood quicker. And lower level alcohol in the blood still affects GABA receptors but doesn't stimulate dopamine. Women tend to experience the effects of alcohol for a longer period because they metabolize alcohol more slowly and have higher blood alcohol levels. This is due to having fewer enzymes that metabolize alcohol and generally having a smaller body mass. Eating food, especially fats and proteins, with alcohol can decrease its absorption, allowing the body more time to metabolize it. Regular drinkers produce more of the enzymes that metabolize alcohol, enabling them to process it faster compared to non-drinkers. People who metabolize alcohol slowly tend to experience alcohol effects for a prolonged period, so they stay active and talkative longer. This is because high blood alcohol levels suppress prefrontal cortex, which is responsible on decision-making and controls our actions. And when brain suppress this center, person experiences disinhibition. On the other hand, those who metabolize alcohol quickly become sedated and sleepy more easily. In their case, blood alcohol levels decrease faster, leading to reduced dopamine stimulation while GABA receptors remain sensitive, causing sleepiness. Why do some people feel euphoric and awake longer while others feel more sleepy? Those who metabolize alcohol more slowly stay awake longer because of the higher concentration of alcohol in their blood. People who metabolize alcohol faster become sleepy and less active after drinking. Another interesting question is why some people become aggressive and irritable after drinking while others do not. The quantity of alcohol intake and individual predisposition play significant roles. If a person's mood is negative before drinking and they consume a large amount of alcohol, there is a higher probability of retaining high dopamine levels, which increases motivation and stimulation but, along with decreased glutamate activity, leads to poor judgment and decision-making. Frequent drinkers may develop a tolerance to alcohol's sedative effects, but not to its impact on neurotransmitters like dopamine, potentially leading to more pronounced behavioral changes. Additionally, many Asians have a genetic variation that makes them unable to metabolize alcohol effectively. This leads to the accumulation of acetaldehyde, a byproduct of alcohol metabolism, causing skin flushing, dilation of blood vessels, nausea, vomiting, and rapid heartbeat. Health risks of chronic alcohol intake. Chronic alcohol consumption can lead to various health issues, starting with the liver. Initially, it can cause fatty liver, a condition where fat builds up in the liver. This stage is reversible if the person stops drinking and adopts a healthy lifestyle. If alcohol consumption continues, it can progress to cirrhosis, a more severe and irreversible liver disease. Alcohol also significantly increases the risk of hypertension, high blood pressure, and heart diseases, such as cardiomyopathy, a condition where the heart muscle becomes enlarged or weakened. Additionally, it raises the risk of stroke. Over time, alcohol can damage the brain, leading to cognitive impairments and memory problems. It also increases the risk of several types of cancer, particularly in the liver, mouth, throat, breast, and colon. Alcohol can cause various other symptoms, including hallucinations, especially during heavy drinking or withdrawal. Chronic alcohol use can lead to a severe condition known as delirium tremens, DTs, a form of alcohol withdrawal characterized by sudden and severe mental or nervous system changes. Symptoms of DTs include fever, rapid heartbeat, and psychosis, where the person loses touch with reality. DTs typically occur several days after a person stops drinking and require immediate medical attention, including hospitalization and rehydration therapy. Benzodiazepines are often used to sedate the patient and manage hyperactivity. DTs occur because the brain adapts to the effects of alcohol on neurotransmitters GABA and glutamate, leading to decreased GABA activity and increased glutamate activity. Sudden cessation of alcohol causes a hyperactive state. Safe dosage of alcohol. The concept of a safe dosage of alcohol is highly debatable. However, the most accepted view is that moderate drinking involves consuming up to 1 bottle of beer daily for women and up to 2 bottles for men, which translates to roughly 150 milliliters glass of wine. According to the Centers for Disease Control and Prevention, CDC, alcohol intake should be limited to these amounts or less. The key message is to limit alcohol consumption as much as possible. Modern medical guidelines generally recommend either no alcohol intake or minimal consumption. There may be no truly safe limit because alcohol is a toxin, and even low amounts can increase the risk of several cancers. Alcohol is classified as a Group 1 carcinogen, meaning it is a well-documented cancer-causing agent in humans. Even 1 drink a day can elevate the risk of breast cancer, colorectal cancer, and throat cancer, especially when combined with smoking. This is also true for cardiovascular diseases such as hypertension, atrial fibrillation, and fatty liver disease. While the concept of the French paradox suggests that people in France live longer and have lower rates of cardiovascular death despite a diet high in saturated fats and moderate alcohol intake, recent studies indicate that the risks of alcohol outweigh its benefits. The French paradox was initially attributed to the consumption of red wine, which contains antioxidants like resveratrol and polyphenols. However, current thinking suggests that the longevity and cardiovascular health observed in the French population are more likely due to their Mediterranean-style diet, which includes a balance of fresh fruits and vegetables, unprocessed foods, healthy fats, and small portions, rather than the alcohol itself. In summary, while moderate alcohol consumption might be culturally accepted, modern medical advice tends to favor limiting alcohol intake as much as possible due to its significant health risks. How to stop drinking. Naltrexone. It works by blocking the release of dopamine in response to alcohol consumption. This means that even if a person drinks alcohol, they do not experience the pleasurable effects typically associated with it, thereby reducing cravings. Administration. Naltrexone is available in oral tablets, taken once a daily and injectable form, administered once a month. Treatment with naltrexone usually continues for several months. Acamprosate mechanism. Acamprosate helps restore the balance between GABA, a calming neurotransmitter, and glutamate, an excitatory neurotransmitter, in the brain. This can decrease withdrawal symptoms and reduce cravings for alcohol. Best for individuals who are already abstinent and want to maintain sobriety. Acamprosate is oral tablets usually taken 3 times a day. Treatment typically lasts several months, up to a year. Disulfiram. Disulfiram inhibits aldehyde dehydrogenase, an enzyme crucial for alcohol metabolism. This causes the accumulation of acetaldehyde when alcohol is consumed, leading to unpleasant effects such as skin flushing, nausea, and vomiting. These symptoms resemble the reaction some people of Asian descent experience due to a genetic variation affecting alcohol metabolism. This serves as a deterrent to drinking. Best for highly motivated individuals who have already achieved abstinence and are seeking a strong deterrent to prevent relapse. Administration. Oral tablets, typically taken once daily. The common dose is 250 mg, but it can range from 125 mg to 500 mg depending on the individual's response and medical advice. Duration. Disulfiram can be used for several months to a year, depending on individual circumstances and treatment goals. Topiramate, off-label use. Mechanism. Topiramate reduces the release of glutamate and enhances GABA activity. This dual action helps diminish the brain's craving signals and the excitatory effects of alcohol. Best for individuals who have not responded well to other treatments, those with co-occurring conditions such as epilepsy or migraines, and people with comorbid psychiatric conditions. It can help reduce the frequency and amount of drinking and support abstinence. Administration. Oral tablets or sprinkle capsules, the dose is increased slowly to minimize side effects, starting at 25 mg per day and gradually increasing to a target dose, often around 200 to 400 mg per day in divided doses. Gabapentin, off-label use mechanism. Gabapentin modulates GABA activity and can be effective in reducing alcohol cravings and withdrawal symptoms. Best for it may be particularly useful for people who experience anxiety and insomnia during alcohol withdrawal. Administration. Gabapentin is taken in oral tablet form, with the dosage adjusted based on individual needs and response to the medication.